Good day, respected ma'ams and sirs. My name is Simrith Anand, and I am an undergraduate student who's just recently finished an honours degree. I am a prospective candidate applying to the Applied Forensic Psychology course at Edinburgh Napier University. My laptop is right next to me here by the camera, so if I keep looking at that side, it's because I'm looking at my notes. Okay, starting with the interview questions. The first question is, why have I applied to this course at this university? Okay, so looking at the bigger picture and working my way inwards, the university website in itself already struck out to me in comparison to the rest of the university websites I have seen. And by this point, I've seen a lot of different university websites. And the reason why I say this is because I found that Edinburgh Napier University focuses more on the lecturers that are going to be teaching us rather than giving us a more very detailed insight and outline to the modules that we're going to be learning about. And I find this more important and significant because, as crucial as the content can be, I find that who I'm taught by and how I'm taught is more important to me. So I saw that there were two amazing lecturers that immediately caught my attention, which is Dr. Faye Skelton and Mark Kozlowski. Dr. Faye Skelton's work on face perception and eyewitness reliability and how certain facial features have specific connotations that they follow, essentially falling into stereotyping and profiling, which is something that you learn actively not to do in psychology and you become more self-aware of. It's enlightening and inspiriting for me to know that I'm going to be learning more in depth about this topic from someone that specializes in this field. Moreover, Dr. Skelton's work on preventing and understanding the miscarriages of justice is something that falls in alignment with my passion, and I'm going to touch more bases on this in my further questions, in my further answers. Mr. Mark Kozlowski, not only is he the course leader for this degree, but he actually actively takes students under his wing and tries to help them navigate through implementing theory into practice and helps guide them through their BPS chartership, which I find so inspiriting because, I mean, someone with his expertise is going to be taking me in and showing me the ropes is something that, like I said, is so inspiriting. So it's only a privilege to be taught by such esteemed lecturers and by this esteemed university. That's why I've chosen this course at this university. Okay, the next three questions, which are what subjects I've learned in relation to forensic psychology, what questions I've had about them, and any relevant work experience, I'm going to answer in one answer. Okay. I have studied a few modules in relation to forensic psychology. I think two that stood out most to me were abnormal psychology and psychopathology. And this is because both these modules taught me about the presentation and onset of multiple different psychological disorders and how they look on different people coming from different backgrounds. And when I first learned about this, it was so enlightening that I thought that clinical psychology was going to be my chosen pathway. But then, as a requirement for my undergraduate degree, I had to complete 100 hours in the field. And that's when I was placed in the clinical setting under the supervision of a clinical psychologist. And I worked at a hospital where I saw patients one-on-one. I counseled patients one-on-one. I ran a workshop series for Mental Health Awareness Month, and I facilitated a few group counseling sessions. And here I had my first ex-convict as a patient, and just the way this patient spoke about his life, about how he feels about like being an ex-convict, how life has been for him after committing the crime, and how the family has like accepted him and not accepted him. And it was these kind of things that started like questions that are arising in my mind, where I started to question things a lot. And I wanted to know further about the layered impact criminal behavior has on a person and their family, and why they want to do it, looking from the biopsychosocial lens, what triggers them and what doesn't trigger them. And that's this entire argument then falls into nurture versus nature. And this is kind of the questions that are arising within me. But then this year, I wanted to gain more clinical experience, so I am working at three different hospitals. Two of them are government tuberculosis hospitals, and the other one is a psychiatric hospital where I run a few psychoeducational workshops. But one of them, I actually coordinate and lead in a forensic ward, which I've been doing since the beginning of this year, I think. So that entire experience has been very enlightening and has taught me so much about working within the field and applying theory to practice and using different psychotherapeutic interventions. And this entire experience has been very eye-opening for me. And the two cases that I actually spoke about in my personal statement also come from these hospitals, where in one of the hospitals, one of the patients within a group counseling setting disclosed to everyone how he was an ex-convict and he had gone to prison for however many years for manslaughter. And just the way this patient spoke about his story, how he justified his actions, the remorse he had and didn't have, it really just stirred something inside me. I wanted to learn more about people like that. I want to learn more about what their values are and what their morals are and what kind of role they want to lead in their lives once they have committed a crime and how they want to like resume regular living after that. And it was within this that I started researching further into forensic psychology, and I found that there were so many crimes there where innocent people had actually gone to jail and then served however many years just to be exonerated, and then they're just assumed to resume regular living. And I read a startling statistic about that, where it was around 27,500 hours plus years that individuals that are exonerated have served in prison just to find out that they were not guilty afterwards. And it really makes you think about what they have seen inside, what the kind of trauma not only have they seen but probably even experienced, and what they had to do each day to survive, and how after all of that they're just thrown back to reality and they just have to resume regular living. The two cases that really stand out to me are Walter Macmillan, who was sentenced to not only life in imprisonment, but he was sentenced to the death penalty, and he has died. And only after his death did they find out that he actually wasn't even guilty. So it really makes you think about the miscarriages of justice that occur with individuals like that. I mean, just recently, 2 weeks ago, there was an Australian woman that served a sentence for 30 years, but she was released 2 weeks ago after serving 20 years because she was found not guilty. So it's stories like that just like really move me. And like I said before, like what all have they seen inside to then just be like thrown back to reality. I mean, I know for sure in India and in South Africa, there's not a lot of rehabilitation centers or workshops or places that these ex-convicts can go to like learn how to be functional members of society. So this is also where my interest in the future lies. And this is also where I want to learn about sentence processing and jury behavior and eyewitness reliability. And that's what I was trying to say with Dr. Faye Skelton. I mean, her passion lies within understanding and preventing miscarriages of justice. And that's directly in line with what I also want to achieve one day. Okay. About the piece of research I've been involved in, I participated in a research thesis for my honors degree last year. I wanted to focus on men's mental health because I found a major disparity of research studies that were conducted on men, where most of them, if not all, in South Africa at least, were focused on aggression, substance abuse, violence, and anger. So I wanted to kind of shift the narrative and look at the causal factors of these reactionary behaviors. So I looked at masculinity and self-esteem. I did a quantitative cross-sectional study. The aim of my research study was to investigate the relationship between the level of adherence to hegemonic masculinity to male self-esteem. Hegemonic masculinity is just traditional masculinity. These variables were measured using the Rosenberg Self-Esteem Questionnaire along with the Male Role Norms Inventory short form, or the MRNISF, This scale was founded by Ronald Clevant in 2013, and he's the Dean Emeritus of the University of Ohio, with whom I got in direct contact with to gain permission to use the scale. I also created a demographics questionnaire to gather some descriptive statistics for my study. The sampling methods that I used were snowball sampling and convenience sampling, and this was mitigated through the use of my own social media platforms. I gathered a total of 80 South African participants, male participants, of which 38.8% were white and 36.3% were colored or mixed race. The ages of my sample population were 19 to 77 years old, with the modal age being 23. The data analysis that I used was a statistical package of the social sciences, with the method of analysis being the Pearson's product moment correlation, along with the analysis of variance or an ANOVA. This was for my inferential statistics, and then for my descriptive statistics, I used a demographics questionnaire and depicted this through bar graphs and histograms. My most significant findings were the weak positive linear relationship, R equals to 0.242, between the total scores of the MRNISF along with the total scores of self-esteem. And another relationship was found through an ANOVA between the total scores of the MRNISF and the sexual orientation. This was a statistically significant relationship where P equals to 0.109. Okay, moving on to the next two questions that I will also be answering as one. How will I manage my time realistically, and how do I feel about engaging in reflective practice? I'm going to start by saying I absolutely love reflective practice. I have been doing this since my undergrad journey when I first started studying about psychology and learned the value of reflection. This is the method that has worked for me since that time. I know for a fact that with every task or with every patient or with every case that I deal with, I need to reflect and then process how everything went down, what I can do better the next time, and what didn't work this time. And that's how I compartmentalize and then move on to my next task. This is just my method that always works for me. I have created beautiful, strong relationships with my supervisors. I value my supervision time, not only to gain valuable input and advice and guidance from my supervisor regarding my cases, but also to speak about how the stories have impacted me and how I need to go forward and what I can do to make myself a better practitioner. So I love reflective practice, and I definitely know that this is how I'm going to be managing my time realistically. I've also worked along with studying at the same time, so I know that I can manage my time realistically. I know I've been through a similar kind of workload before, and postgrad is going to be a lot difficult, but I know that I can do it through my process of reflection. And lastly, about how masters fits into my future plans. Well, like I said before, I really am passionate about learning about sentence processing and jury behavior and eyewitness reliability. I feel really passionate about learning about the miscarriages of justice and how me as a practitioner, I can best help my clients or anyone around me, really. I think my mindset right now is that I want to pursue my doctorate in forensic psychology, just because I want to be as qualified with as much experience in that regard as possible, so I can offer myself as the best practitioner possible to my future clients. And yeah, I really feel strongly about being the best I can possibly be. I value self-awareness and learning every single day, and I believe that this master's program is the best fit for me currently right now. And it's the stepping stone to me achieving my dream and my goal. So thank you. This is the end of my interview. Thank you for listening. I hope you all have a great day further. And yes, this is Simrat Anand. Thank you.